mind over matter, where wellness meets innovation and personal breakthroughs begin with bold ideas. I'm your host, Anya, and today we are diving into a revolutionary tool reshaping the future of healing. Our guest, Forrest Smith, is the co founder and CEO of Kineon, a health tech company pioneering in wearable therapy devices like the Move Plus Pro. With a 20-year legacy of startup success and a deep love for cutting edge wellness, Forrest is bringing red light therapy into the spotlight. And it's not just for athletes or biohackers, it's for anyone ready to reduce pain, recover faster, and reclaim mobility. Let's explore what red light can do that conventional treatments often can't. Welcome to the show, Forrest. It's an honor to have you.
Thank you so much. I'm super excited, and I really appreciate you taking the time with me today.
Mhm. So, Forrest, for those new red light therapy, what exactly is it and how does it work at the cellular level?
That's a great question, and we spend a lot of time on this with our team. We've got a great physiology team, and our technical team from the laser side work really well hand in hand on this. And yeah, tens of thousands of hours in on this exact subject. So let me roll up my sleeves a little bit, and I think the one of the main questions that we get about this is, has this been kind of medically researched? And at this point, we contribute to an international group of researchers in this space that collect and collate research papers on the subject. In our database are over 7,000 different randomized controlled trials, research papers, um, uh, policy and position papers, meta-analyses, et cetera. And it's a really well-documented and well-researched technology for a number of different uses. And the ones that we really tend to focus on are reducing inflammation, increasing blood flow, and reducing oxidative stress. And to do that, what we do is, with different specific wavelengths of light, we target photoacceptors in the body. And these photoacceptors, there's about 8 of them, but really most of the results come from the top 4 or 5. And to give you an example of one, so we don't go too far in the weeds on the biochemistry and put everyone to sleep, one of these is hemoglobin, which is a carrier molecule in our blood. And hemoglobin we target with infrared 808 nanometer lasers. And the effect of targeting the hemoglobin is to remove the bond from nitric oxide to hemoglobin. And the outcome for this is there's more nitric oxide in your blood on one side, and the nitric oxide is a dilating factor. So it actually increases the size of your blood vessels and adds plasticity or flexibility to these blood vessels. So it helps you reduce stiffening of your cardiovascular tissue. And it also allows you to deliver blood and oxygen more effectively. And that's because not only does it allow the blood flow to increase by increasing the size of the blood vessels and dilating them very effectively, it also removes nitric oxide from a competitive binding site with oxygen. And so when you remove the nitric oxide, oxygen can bind more readily to the hemoglobin and be delivered to the cells where it's needed for energy generation. So that's one example of a number of different photoacceptors in the body that we target and trigger with light and photon delivery.
Mm-hmm. That's amazing. And how is Move Plus Pro different from other red light devices on the market?
The time that our team has spent on the dosing models around this, first of all, dosing is incredibly important for the outcomes that you want to see. So when you're targeting these photoacceptors in the body, you have to know where they are, and you have to most effectively deliver to them, map and model how these devices, like a laser or an LED device, are going to deliver photons to these photoacceptors. And we see a lot of products in the market. And again, we don't like to kind of knock other people's products. It's always great to see, red light panels and things like this, and people being exposed to red light therapy. But one of the things that you see with red light panels, as an example, is it's not emitting at the skin level and is using LEDs only. And What we've found with LEDs is that treating superficial tissue is easy, and it's a very simple product to get out to the market. So if you're treating for something like wound healing or increasing the amount of type 2 collagen you have in your upper layers of skin, the panels are not a terrible solution for this. The downside for it is the dosing is very different if you're 2 inches away, 2 inches further away, or 2 inches closer. So the dosing from the panels, we kind of look at these as Gen 1 products for red light therapy. They don't promote the best dosing possible. And we use lasers in our devices to dose more effectively to the internal tissue as well. So our devices are wearable. They're easier, kind of lower friction points to be able to build habits around. And so we find we've done kind of head-to-head tests, but essentially the dosing and the results you get are more consistent, more reliable, and better overall versus other products in the market. And the device is wearable, travel friendly, and really has been built to lower the friction points for building habits around it on a daily basis. So we find our users getting much better results long-term because they stay in, they see the short-term results, they stay in and continue using the product, and they get better results long-term and have healthier tissue and better medical outcomes because of that.
Mhm. I've seen a lot of wellness fads come and go, but red light keeps gaining traction. What makes it consistently effective?
I think one of the biggest things is that when you can increase the functionality of your mitochondria, we target a number of different photoacceptors in the cell, and those are really based around the mitochondria. And one of the biggest impacts that we see with our users is that their mitochondrial function increases. So one of the ways that that's been measured from a medical standpoint is your mitochondria are the powerhouses of your cells. They create energy currency for our cells to use, and you can measure this energy currency. It's called ATP. ATP production from your mitochondria increases by double over the first 7 to 12 hours of using the photobiomodulation. When you're able to increase the energy usage of your cells, wound healing, neurological function, cognitive function, there's really so many downstream benefits that when you have it as a device that's dosed well and that's easy to use, like the Move Plus, the users see long-term health benefits, and they become really kind of flag-waving advocates for this type of product. And so a lot of our business comes from our customers, our users, recommending other people use the devices as well because they've just had such a good experience themselves.
Mhm. Absolutely. And what inspired you to create Kineon and dive into this space of wearable light therapy?
We started this company, my partner Tom and I, with the mission. We've started startups before with the mission to build a large company and to exit and to create something that's useful for the world. With this company, we took a very different tack with our mission, and it's not built to exit. Uh, our company mission is to increase the quality of life for the largest number of people we can in the most measurable way we can, and that makes all of our decisions much easier. And it puts us on a path to be able to provide the best outcomes we can for users and really focus on both what are they experiencing from a day-to-day and spend a lot of time interacting with them on the outcome. So this is really, I think, the inspiration for us. And we see so many testimonials now. We have over 50,000 devices that we've shipped to users who are using these in a way that allows them to get away from harmful pharmaceuticals like opioids and NSAIDs, and the impact of that on their life, on their mortality, their lifespan, their health span, especially for our older users, has been just amazing. And so really the mission is what started us on this path and then on this journey. And it's also what carries us through and motivates us on a daily basis. We see such amazing stories where people couldn't sleep through the night for 10 years because of chronic pain. And now they're able to sleep. They couldn't walk up the stairs. They couldn't walk across the grocery store. And now they're able to do that. And I think while we do work with a lot of high performance athletes like the NBA and NFL and special forces with the military and things like this, and those are very exciting. Those are all people that I look up to and are really world class in their discipline and in what they do. What excites us the most and what really kind of motivates us on a daily basis is the stories we get back in from our older users who are extending their lifespan and their health span by being able to use a device like this.
Hmm. That's great. And was there a personal experience or pain point that sparked this journey?
From my side, I have old injuries. I've always played sports my entire life. And so I had old injuries in my back and my knee. And I'm in my mid 40s now. And I've seen these same issues continue to flare up. I still train CrossFit and I still play rugby. And it's two very high intensity sports, and because of that, my knee flares up occasionally, and my lower back flares up. And it used to be in my 30s that I would be out for months at a time because of these flare ups. But right now, with the device, I can now get back into training within 3 to 4 days, reduce the inflammation, and continue in movement. And because of that, I'm actually stronger and healthier in my 40s than I was in my 30s, just by removing those pain points. And I think that was part of my own personal journey with it. But I've also seen my parents who are in their 70s be able to use this for being able to maintain kind of walking patterns and protocols that they're doing from a training standpoint. And so really the early days of the product was, and the product development and our testing and our medical testing around this was really focused about ourselves and our families, and trying to get our all of us into a healthier movement pattern and away from pain and injury and back into movement and sport. And that really has had a big steering and motivational impact for all of us as a company.
Founders who solve problems they've lived through always bring something special to the market.
Yeah, we've actually it's been such an awesome space, and I'm so grateful to be in this space right now for health and wellness. We also spend a lot of time with other founders who are trying to solve problems like this, and I think when you develop a product and you know the pain point, the literal pain point yourself, it makes it easier to understand how to build a product that's going to help people with this. And everyone has a different experience, and so we do try to we have a very strong community. Our Facebook community uh, on Facebook groups has been just an amazing place. We've got 6 or 7 thousand users in there now, sharing their stories and working with us directly to understand how we can most effectively update and improve the product. And their input has really been what steers our development and what we listen to long term, so that we can help people have a better user experience and continue to use the device as long as possible, because it has a really powerful long term impact on health and wellness.
Hmm. Definitely. And you've got elite athletes, older adults, and tech lovers all using Move Plus Pro. Why is this kind of therapy becoming so universally relevant?
I think everyone's got a slightly different use case. So when we work with the U.S. Olympic weightlifting team or the NBA, a lot of times they're looking to have their athletes recover faster from very strenuous and intense workouts, and the technology works extremely well for that. Um, on the other hand, one of the things that we're seeing the best outcomes for is chronic inflammation and chronic pain, and that's what we see in our older users. So there's very different use cases, but I think the commitment to being able to use a device and a technology to be able to add movement and help recovery in so many different use cases is why people are using it. And it's one of the reasons why we also offer a 30-day money back guarantee. And while we also, my partner Tom and I really want to know when people aren't getting what they need out of the device. And we actually have put our own calendars out there so that people can arrange calls with us. If they're not getting what they need out of the device, we ask that they call in with us and tell us what their experience has been. And that's really been a great way for us to understand how users are using the device, and then where there are limitations or issues that we can address with the design. And with the design updates that we've seen over the past 3 to 4 years, we've done that a number of times, and we continue to see a better and better user experience, whether it's an 85-year-old person really just trying to get up and down the stairs more effectively and get back into movement, or if it's a 7 foot tall NBA basketball star who's has a high ankle sprain and wants to get back on the court sooner rather than later. The outcomes that this provides is really powerful, and has given people what we set expectations as reasonably as possible, and we meet those expectations, or we change something to be able to meet them.
Hmm. That's amazing. And are there specific results or user transformations that have surprised even you?
Yes, I think we see these now, again, with our team so focused on bringing measurable results to our users. We see testimonials, both video and photo and text testimonials in some of our group chats on a weekly basis, where it's really on a daily basis, but kind of once a week we sit down and go through these, and we see such amazing outcomes where, again, one of the things that we see, particularly with our older users, is there's a really nasty and invidious nature of how inflammation attacks and degrades their tissue. And when you can give them a tool that they can actually fix these ongoing chronic pain and inflammation points, they find themselves getting back into walking and moving and playing pickleball and really being able to enjoy life, and not just extend their lifespan, but also enjoy the years that they do have. And for me, that's the most powerful thing that we've seen. And it's again, this is what motivates it. It's very hard building a startup. Hours are very long, and it's very easy to become discouraged. But if our team ever need motivation, we sit down and we go through our testimonials for particularly our older users who are adding years back to their life, but also just enjoying the years that they have in a really powerful way. That when they couldn't pick up their grandkids because of back pain, and now they can. When they couldn't sleep through the night, again, when they can't walk up the stairs, and they're back to doing 2 or 3 mile walks after that. The impacts of this, not just on them, but on their families around them and everyone they interact with, is just so powerful that it's really, this is what motivates us as a team to execute at the highest level we can.
It's fascinating how a single modality like light can adapt to so many healing journeys.
It is, and it also brings up reasonable questions. People are skeptical, particularly a lot of our older users are skeptical that how could it possibly treat this NBA guy, then also treat what I'm using. I think one of the things that we focus on from an educational and research standpoint is demonstrating to our users how bad chronic inflammation is for you, and how much, when you can reduce that inflammation, it's going to impact your life. And I think when we focus on the mechanisms, people understand clearly this isn't something. One of the things that we see from a pharmaceutical standpoint is many pharmaceuticals are just targeting the outcomes. So there's a drug for strokes, and there's a drug for heart disease, and there's a drug for a lot of these issues that really start from the same place. When you have metabolic dysfunction or metabolic disorder, all of these different pathologies, all of these different diseases come from this same metabolic impairment that you have. When you're able to treat this metabolic impairment, this is why you're able to treat a number of different pathologies downstream, because you're actually treating the upstream cause of what's creating these different diseases in the human body. And so, again, we spend a lot of time with our scientific advisory board and our research partners with the different labs that we work with around the world, demonstrating and focusing on education around what the mechanisms are for this, so that people don't feel like we're trying to talk to them about a snake oil product that's going to fix 100 different pathologies. We're talking about a very clearly medically researched and validated technology that will fix these upstream issues from or help to fix these upstream issues from a metabolic and inflammation standpoint. And I would like to also say that we do a lot of coaching. This shouldn't be the only tool in your toolkit when you're addressing these issues. One of the things that we focus on a lot with our medical professionals, we've got over 500 doctors and physicians and clinicians that are working with us as resellers, and they use these products in their clinics for people who are post-surgery or coming to them for any number of recovery modalities. But the key for this is attacking these issues from a more comprehensive way. So there's a dietary piece to this, there's a movement and exercise and training piece to this, but having one more tool in your toolkit, like laser therapy, really moves the needle and helps to provide a much more effective overall and comprehensive approach and a faster outcome, a faster recovery for all of these modalities.
Mm-hmm. 100%. And you live in Mexico, speak fluent Chinese, and have scaled startup globally. How has your global perspective shaped your approach to health innovation?
I think with our company, we've taken an unusual approach, which is let's find world-class people in every seat in the company, and then we can build systems to be able to close the gaps between them. And there's really powerful upsides to this, and there are downsides as well. The systems that we have to build are much more robust, and we have to spend more time on calls between each other, and we have to travel around the world to meet each other. But the upside for this is that every seat, whether it's our head of physiology, our head of laser research, our marketing teams, really our operational teams, everyone in the company is world class at what they do. And when they are, and really motivated to be able to deliver these type of outcomes and these life-changing impacts for our users, it's a very motivated and tight team that comes out of that. And so that's really been kind of the approach that we've taken with our worldwide kind of spread and geographically disparate team, is to just find the very best people for everything. And it's nice whenever we feel like whenever people interact with our company, whether it's our customer service team or our research team or our design team, et cetera, we feel like that represents us well and allows us to execute on a level that's difficult if we were to limit this to one geographical area.
Mm-hmm. Health tech shouldn't just be smart, it should be human.
That's right. That's right. And there's, even from a use case standpoint, I know all of the research, and I know that I should be using this device in 6 different ways every day, but I also find myself using it maybe less than I should, based on just having a busy day. And so, one of the things that we've done with the product design is really try to design it to make it as easy as possible for people to adopt. So, some of the things that have come back from our users, one that came back from an NFL team using the device was, my team loved this, but whenever we go traveling to carry it on the airplane, they have to push us through a different line in security. And so we've done things like going for additional FCC registrations so that you can carry this on the plane without having to be inspected separately. So it just clears through security, and it's much easier. And I think all of our design and product updates and regulatory and research have really been around how to humanize the use of this product and how to listen actively to our existing users to understand what are the limitations that they're finding. And We want to take on as much of the responsibility and accountability for our users being able to use the device effectively and long term as we can, and that's really humanized the design of the product to be able to make it as effective and as easy to continue on and as convenient to continue on as you can.
Mm-hmm. Forrest, thank you for illuminating the power of light in healing. Your work is proof that when innovation meets intention, lives change, pain fades, recovery accelerates, and people thrive. And to our listeners, if you're looking for smart, non invasive ways to care for your body, Move Plus Pro might just be your next step. Explore the science, test it out, and feel the shift for your body. Until next time, stay curious.